My Lady. My Lady, I, alongside Mr Weatherby, King's Counsel, Miss Stone and Mr Weaver, represent the Covid Bereaved Families for Justice UK, instructed by Nicola Brooke, Elkin Abrahamson, Claire Fletcher and Zoe McConville of Brodie Jackson Cantor Solicitors. I recognise this is the last chance that I have to address this inquiry on behalf of the Covid Bereaved Families for Justice UK. And in this short closing, my only objective is to try and do some justice and some context to the voices that you've heard over the past 2 days. Many of us who've spent the last 3 years in this room and these corridors have reflected that this inquiry is unique amongst public inquiries, an inquiry in which all of us in this room have been impacted by the subject matter of scrutiny. If we all take ourselves back 6 years from today to the 5th of March 2020 and what we as members of the public knew about Covid-19, on this day it was added to the list of notifiable diseases. There was 115 confirmed cases in the UK and people were bulk buying hand sanitizer and other household essentials. The UK public was only being provided with weekly updates, and yet we were only 18 days away from an unprecedented national lockdown. As Rabinda Sherwood told you yesterday, people were taking their own precautions, but yet no alarm was raised by the government. We all recall the confusion and the lack of clarity around what measures we should be taking to keep ourselves and our loved ones safe. As a result of our shared experience, everyone in this room and every member of the public has an interest in this public inquiry and the recommendations that you will make about the improvements to planning, preparedness and decision-making for the next pandemic, because it could have been any of us, and it could be any of us in the next pandemic. But specifically at the heart of your inquiry, my lady, should be those who were bereaved by Covid-19. And having listened carefully to the evidence over the last 2 days, no one could have any doubt why the bereaved fought for this inquiry. Their experiences and their loss are the reason why they have come together and campaigned and challenged the official narrative on Covid-19. The bereaved witnesses from all 4 nations have been generous enough to share their thanks to the inquiry for hearing them and their experiences. So may I express our gratitude to the bereaved families who not only fought for this inquiry, but who've continued to fight during this inquiry. They have fought to find out what happened, and they are still fighting for answers and reassurance that things have changed. We are grateful to Matt and Joe and all the witnesses, contributors, organisers, campaigners, moderators and supporters from the Covid Bereaved Families for Justice UK across the UK 4 nations for their ability to keep going, keep sharing and keep challenging. In their darkest hour, they collectively recognised in each other the unique and complex grief they were suffering, before any support services could even grapple with their experience. A searing grief compounded by the uncertainty, shock, and in so many cases, the significant trauma of knowing that their loved ones suffered harm that was avoidable. But Covid Bereaved Families for Justice UK is engaged not only in the support of the Covid bereaved, but also the memorialisation of those who died, through the establishment of the National Covid-19 Memorial Wall and other national and local memorials across the UK, both physical memorials, cultural and social memorials. Sometimes something as simple as a heart drawn on a wall, a poignant piece of music played, or a photograph in a frame sitting on a desk every day in this hearing centre. This Sunday, the 8th of March, is the 5th National Day of Remembrance, and amongst the questions that the bereaved families will be asking themselves that day is what has changed since their loss. My lady, in this moment, in 2026, accountability and change for the future are everything for the bereaved. We recognise the significance of the public record that you are establishing and the role of that record as a key part in co-designing for future planning and preparedness. It is vital that the public record of this inquiry achieves three key aims. First, to understand existing issues and inequalities. Many of the impacts on the bereaved and beyond were caused by unaddressed structural discrimination and/or lack of investment in public services. Second, to understand what happened, the key decisions that were made. But thirdly, now in this module, you are able to understand the impact of the decisions that were made and the impact that they caused. My lady, you cannot truly extricate impact from the decision-making because there are distinct layers of impact that you've heard evidence about in this module. For example, in your Module 1 report, you found that had the UK been better prepared and more resilient to the pandemic, some of that financial and human cost may have been avoided. You've heard in this module the cost of that impact of the lack of planning, the lack of preparedness and lack of proper resourcing. You have also heard in Module 5 and Module 6 that there was no adequate stockpile of PPE for healthcare and social care workers, let alone family members and visitors for those in hospital and social care settings. Rabinda Sherwood recalls asking for PPE to see her dying father, to be asked by doctors if she really wanted to take that PPE from a nurse. A well-prepared and resourced system would not present this Hobson's choice. In your Module 2 report, you found that the March 2020 lockdown should have been introduced a week earlier. The impact is that there were 23,000 deaths avoidable. One of those deaths was Rivka Gottlieb's father, Michael. My lady, every person who lost a loved one through COVID-19 has suffered a distinct loss and suffers a unique and complex grief. You have heard now directly from the bereaved families, and nothing that I say could articulate it better. I only seek to underline some key points. Dr. Emily Harrop's report outlines the complex and overlapping layers of grief that the COVID bereaved has suffered, which resonates with the evidence they have given. Most significantly, Dr. Harrop highlights the specific and compounding impact of losing someone as a direct result of a pandemic of an unprecedented and untreatable pathogen, COVID-19. The guilt, the feeling helpless, when in reality they had no choice to be with their loved ones, that choice was taken away from them. The guilt they've expressed about not being able to be there, but they weren't allowed to be there. Dr. Glenn Grundle from the Northern Irish Bereaved Families told you on Tuesday, when he lost his beloved mum, COVID was every second word, an unwelcome and constant reminder of the source of her death. He also told you the trauma and frustration of repeatedly asking the same questions of different organisations and still not getting an answer. Given the lack of coroner's inquests or other forms of independent scrutiny into these individual deaths, this inquiry cannot now answer them. These questions will still remain. As Dr. Langford from Cruise told the inquiry, workplaces, community spaces and supportive networks, which were often the best support, were inaccessible. At many times during the pandemic, the bereaved could not even receive a hug from friends and family members. And so many of the COVID bereaved bear the additional emotional impact of the disproportionately high COVID death rates within minority ethnic communities, disabled people and older people, and the feelings of anger and injustice at the health and social inequalities that were exposed by the pandemic. All of these experiences, traumas and questions, if left unresolved and unaddressed, are a direct cause of complex and prolonged grief. And the impact, as you have heard, is a total lack of acceptance of the loss experienced over 5 years ago. The inquiry also cannot ignore the impact of the failings in the pandemic response. Dr. Harrop's evidence outlines a significant negative impact of inadequate care provision for those infected by COVID-19 and inadequate communication with their families. Mrs. Sherwood's evidence, the lack of care her parents received and the grief and trauma that this has caused her and her family. And there are so many more stories within our written evidence, and not just in every story matters. Another member of Covid Bereaved Families for Justice UK, Claire Farnsworth, recalls the horrors that she directly witnessed and that her mum endured whilst in hospital. She experienced the agony of not being able to be with her mum on many days when she was in hospital, and what she calls the slow car crash that was her being shamefully unprotected from the virus whilst in hospital, and the terrible inevitability of her catching COVID. She describes her precious mum as viewed only as collateral damage by a hospital completely overwhelmed and lacking infection control. My lady, you cannot have failed to have been struck by the impact on the bereaved of not just being able to say goodbye, but the lack of post-death support. For example, in Rabinda Sherwood's statement, an anonymous Covid Bereaved Families for Justice UK member said that the lack of communication led to a tremendous complicated grief, compounded by the fact she was unable to see her granddad at the time of his death, surround herself with a support network or pursue normal activities that would often help with the grieving process. Personally, she found the fear of contracting the virus or passing it on to a loved one overwhelming, and it's taken a long time to recover from the trauma and adverse impact on her mental health. Time and again, the Covid bereaved families have raised in their statements to this inquiry not just the impact of what Dr. Harrop referred to as the moral code disruption, and experienced in the inability to care for and bury their loved ones in a way of their choosing, but by seeing those that they had to rely on to deliver the pandemic response not being held to the same moral and legal codes. For example, the inquiry heard from Maria McArdle from the Northern Irish bereaved families that she lost her mother on the day that Boris Johnson attended a party at Downing Street. This is a key contribution to the disenfranchised grief that Mrs Waterton from the Scottish Covid bereaved described, and the prolonged grief disorder that Dr Harrop tells the inquiry trebled during the pandemic. But having shared their stories with the inquiry, so that you, my lady, can understand the impact, the bereaved families now question, what will the inquiry's impact be? The impact will not just be the careful and detailed public record. The impact will be your recommendations. So may I address you on those now? Rabinda Sherwood has set out clearly in her written evidence her proposals, and we will also carefully reflect on other core participants' proposals in their evidence and in their submissions today, and make a full submission to you in writing. But I wanted to highlight a few broad proposals for your urgent consideration. The first is a recognition of the unique, complex and prolonged grief that the Covid bereaved are suffering from. We underline to you the crew's recommendations, and in particular their recommendation to develop best practice guidance for healthcare settings with specific regard to managing IPC risk and balancing that with facilitating patient and family contact, what Dr. Royston referred to as the peri-mortal period. We urge you to recommend the importance of candid post-death investigations and processes. The bereaved must be able to understand what happened, to have their questions answered. Even though hospitals and healthcare workers were under the most unimaginable pressures, there must be honesty and accountability as to how those pressures translated into the devastating experiences that the bereaved experienced before and after the deaths of their loved ones. There was a lack of sufficient independent scrutiny of the deaths of so many of those who died during the pandemic. Many were certified by coroners as deaths from Covid-19 with no consideration of whether their death was caused by avoidable nosocomial infection, inadequate PPE, or inappropriate applications of ceilings of care. Change must include access to accurate medical records to allow the bereaved to find what clarity and reassurance is available to them. There is also an urgent need for a specialist national Covid bereavement support mechanism. Dr. Hughes from Mind was clear that bereavement support has to be a core part of mental health services. And as one of our members, Claire Farnsworth, says, considering the evidence given to the inquiry in Module 10 regarding the likelihood of prolonged traumatic grief experienced by the Covid bereaved, there is now a vital need for this government in the present to fund specialist Covid bereavement support. We also endorse the recommendations from Dr. Royston that there has to be a cross-government bereavement support strategy and the continued lack of which he described as a notable omission. Finally, my lady, there has to be better resilience in the funeral and bereavement sector. The local government association evidence was clear that the pandemic revealed a real vulnerability in funeral and bereavement sector. Mr. Llewellyn said there was a need for strategic direction at a national level, but flexibility at a local level to reflect the needs of different groups. Mr. Norris pressed upon you the need for co-design. People at the local level, communities, families, know what is needed, and this needs to be taken into consideration for the future pandemic, and there needs to be a better understanding of different faith needs. My lady, you have been asked directly by the families how you're going to monitor the implementation of your recommendations. They want to know what the impact translates into. When the doors close at Dorland House today and the COVID bereaved stand on the steps outside this inquiry, what can they know? What can they rely on is going to change? Because even when the inquiry is over, COVID is not over. My lady, you have said that it will take pressure to implement change, and you've asked for help, and you will have it. But institutional structures to implement recommendations are essential. Your inquiry still has over a year before it formally concludes, and it's within your power to hold further hearings and ask those with the ability to implement your recommendations to update you as to their progress within the existing timeframe of your inquiry. My lady, you can also add your voice to the calls by Inquest, Justice and Dame Ailish Angelini for a new independent public body, a national oversight mechanism with the singular responsibility for collating, analysing and following up on the recommendations arising from inquiries, inquests, official reviews and investigations. You can work with the bereaved families to make sure that other people don't have to suffer. My lady, by way of conclusion, as the inquiry moves on to its next chapter, we remember that without change, the COVID bereaved cannot move forward. But what has stopped them from getting lost in what Dr. Grundle called the rubble of grief is solidarity, strength, and hope. Hope that their experiences won't be repeated. They ask you now to take the baton, to take that burden from them and to take it forward and to ensure that those who can make meaningful change know that they now have the moral and legal responsibility to ensure that those hundreds of thousands of lives lost mean something. Let that be the impact and the legacy of your inquiry, my lady.